Just this morning, we learned that Brooks TLC Hospital in Dunkirk was under an EMS surge diversion overnight after the hospital hit their capacity. Joining us on the program to talk more about that and the COVID-19 vaccine here locally is Chautauqua County Executive PJ Wendel. Sir, thank you for your time today. First of all, can you explain to us what that actually means for residents here in the county who might be needing medical treatment at that hospital?
Well, one of the things people need to realize is that there is a plan in place and that at no time should anybody feel unsafe or feel threatened that they would not get emergency medical care. What happened yesterday was a surge divergence. It was not due to the occupancy of the hospital itself. It was due to the number of cases in the emergency department. This is a system that's been set up since we began our COVID crisis. It worked flawlessly. The system, we were notified yesterday that they were close. Last night, the information came out. Emergency Services Director John Griffith emailed me, texted me, and called, said that this was happening, and we followed it. And the residents of Chautauqua County were as safe as they've ever been. Any critical situations would continue to go to Brooks, but it was any other non-life-threatening would be diverted to other hospitals. We have Buffalo South Mercy, Westfield Hospital, and also UPMC Chautauqua. So we did talk with all three hospitals this morning. They are all back to normal status. Westfield did pick up a few extra cases as overflow from Brooks, but want the residents to rest assured the system was in place. It worked flawlessly, and the residents of our county were in the best hands as always.
So how did we get to this point where you did have to send ambulances for, I don't want to say non-emergent calls, but, kind of triage whether they needed an absolute immediate medical assistance or they could go to a ride to a different hospital somewhere else? Was that because of an increase in COVID patients going into that emergency department? I'm not sure if it had anything to do with COVID patients specifically. A lot of it has to do with the staffing that's available in our hospitals. Remember, our frontline workers have been working around the clock since this began in March. One of the problems we're seeing at hospitals across the state, the region, and the nation are shortages of those individuals that are able to work. And, exactly what we were told the beds were available last night. It was just the staffing was limited, and we were not able to. At that point, they had some, the diversion was there, and this isn't anything that's COVID specific. Should this arise at any hospital any time during the year, for example, UPMC Chautauqua gets, could happen 2 large car accidents with multiple victims. They could be diverting people away, from UPMC Chautauqua. So this is a plan that's been in place for quite a while. The cases were not COVID related. It just was, they met the threshold last night to divert patients, and the plan was implemented as it has been in the past. Yeah, certainly. And I think when you look at these true American heroes, these frontline healthcare workers who really have been in the thick of things for almost a year now, when you think about how long this pandemic has been ongoing, and it's as you mentioned, just not COVID-19, but there are other people still having heart attacks. People are still in car accidents, and now you have to take those extra precautions and have people who come in contact with COVID-19 in a general setting, and to the point where one of the big concerns that we had when we shut down originally was because we didn't want to overwhelm those hospital systems. To have those precautions and go through that system of checks last night to make sure that the hospital, albeit it was very busy and they couldn't, they had to divert people from going to Brooks, to be able to balance and work with other hospitals. Is that, how does that process work, and how can people in the community who see this, assist themselves? Is there anything that they can do?
Well, there really isn't anything they could do, and I think one of the things that people have to realize is how many people knew last night that there was a diverting plan in place, and the residents of this county have been under the best medical care from the very beginning, and will continue to be. Having spent 32 years in the EMS service and fire service here in the county, these are plans that have been established long before I came into office, and before I became a firefighter and an EMT. So the system is working. I really don't say there's anything people can do. People are in need of medical treatment, and they need to, seek that medical treatment. So, it's the first time in our COVID crisis that we had this issue, and again, it worked well. And again, I want people to remain calm. The system worked. There wasn't any critical patients that had to be diverted. There was no question as to anybody's safety. The plan worked as it always has. And again, when most people woke up, unless they saw it on the news or heard a report, nobody knew anything had happened throughout the night. And that's the best thing. It's not a matter of keeping anything, but it's a matter of the system working and keeping the system working. So nobody really knows, that there's any stress. People got to hospitals, and people got the care they needed.
Yeah. And yesterday, switching gears here a little bit, New York State moved the COVID-19 vaccination availability to those 65 and older. At this point, do you know if those 65 and older will be able to be vaccinated here in Chautauqua County soon?
Certainly. Yesterday we had 300 doses go online, and 300 doses were filled in a matter of 20 minutes. One of the things people need to realize is, we've said this before, and as you said, County Executive Poloncarz and I have been in constant contact with this. I don't know how to describe the goalposts are moving. The playing field we're on is changing. We were on a conference call with county executives last week, where we were told we wouldn't go to phase 1B until the end of the month. Within 24 hours, we were in phase 1B. And then there was no indication that we would, lower the age limit from 75 to 65. Having said that, we have plans in place, and they're going to be put in place, and we're going to get people vaccinated. The motto we have statewide, region-wide, and especially here in the county is shots in arms. As soon as we get those vaccines, we're going to get them into the arms of the residents of our county, following the protocols, and we're moving forward. So, again, it's an ever-changing field, and I just can't stress that enough. We are at the mercy of the federal government, the state government, as to when and how much of the vaccine we get. And as soon as we get it, we're getting it into the arms of the residents of our county, as we should.
And I know the governor has said that he wants people to make appointments and to get signed up before the vaccines physically arrive in local areas. In what he says in an attempt to kind of keep that process moving, right? There is time that the vaccines need to be deployed quickly if they're not kept at certain temperatures, depending on which one is being administered. For you, what is your message to residents who want to sign up now, who want to get going on that track, but maybe because of the lack of supply, they can't right away?
That's an issue we have. There are some counties that are allowing people to schedule way out into advance. But the one question we've all spoken to, and these are county executives and county leaders throughout everywhere, and our latest hub was from Rochester down to the PA border and west. Some people are just going to go ahead and schedule, and in the hopes that the vaccine would be there. For us, expectation management is when we have vaccine in hand, we will get those pods up and operational. If people would like to go online and sign up, it's encouraged. But for the county, we are not increasing the capacity of from the CDMS system, the system you sign up for. We're not going to say we can do 500 doses a day if we don't have 500 doses a day. That's expectation management, and people will then lose faith in the system if we start to book slots that aren't available or slots we don't have. As we saw yesterday, when we're looking at 300 doses or 600 doses a week for Chautauqua County Health Department, that's not nearly enough. And we know that, and the governor's even stated that. New York State as a whole gets 300,000 doses a week from the federal government. That is not enough to vaccinate the mass of New York State population. We did have a pod this weekend. There were 600 doses. They were administered, and our staff said we could have done more had we had more vaccines. So, as this rolls out, as the Department of Health are from across the state are asked what their capacity is, we are adjusting and making it happen. But we're at the mercy of the vaccine. Until we get it, we can't put it in arms. And I do not feel it's appropriate to promise people slots and sign up and say Wednesday at noon you're going to have a vaccine, and say, well, we have to postpone Wednesday at noon. So do the people from Wednesday go to Friday? The people from Wednesday go to, it's just too much. So we want to make sure that this is a system that is going to be able to flow, like you said, and be done effectively. I stand by this, and it will continue. Our local health departments, our LHDs, have said the plans are in place. Please let them execute those plans. But for some reason, the vaccine is being diverted through other areas. We're creating another hub, regional hub for vaccine. We don't need to do that. We've urged the governor and county health departments statewide have asked. They have plans. They're the experts. Put it in their hands and let them do their job. I have 100% faith in our local health departments statewide that they can get this done. They're the experts at mass vaccination. They're the ones who have experience in this from H1N1. We can get it done.
So should people go to that state vaccination website and sign up now if they are interested, and then that information would be directed to Chautauqua County, and once you are able to put on those vaccination clinics, so to speak, then those folks will be contacted?
Yes, and how that's going to work, we're not sure. That's a state system. And then, Christine Schuyler, that's their bread and butter. They understand that system in and out. That's what they work with. So I can't comment on that because I'm not an expert in that field. She is. But I spoke this morning at our COVID team meeting. That's a system that works well. They know how to navigate it. They know how to increase capacity. They know how to handle that system in that situation. So I put it in their hands and urge the residents, really, our county is well equipped to do this. Put your faith in our county, and we will get the job done. We've told people, please don't get frustrated. The state sends people around to the county website or the county call center. Erie County's asked them to take their 1-800 number off the list. We've asked the same. Residents are calling a number, then they wait on hold. I was told for up to 6 hours. We don't have anybody that's able to control that. That's coming from the state. The best way is to log into that state website, sign up for the time slot as they become available, and that system is what we will continue to use.
Yeah. All right. Chautauqua County Executive P.J. Wendel joining us today. Sir, thank you very much for your time. We really appreciate it.